2 days before chemo, and I've been recommended to have the flu jab by the doctor and by the chemo nurse. I think they do recommend it for all cancer patients going under chemotherapy, so do check, because the last thing we want to do is catch the flu. So had it today, and it's best to have it 1 to 2 days before your chemo, because that's when your immune system is at its highest. So there's no point in having it afterwards, because you just might feel like crap and you don't want to be doing that. They did give me an injection, which is the one that doesn't give you a bit of the flu. So I had that, so hopefully I won't get a little bit of the flu. It's all very confusing, because then you think, well, why can't I just have that anytime? But anyway, I'm just doing as I'm told. And if you have children that are due the flu jab, or like the nasal flu jab thing, my son does, my youngest son, he's in year 5, he has to have it at the same time as me, and not when the school does it, because if he gets a little part of the flu from the nasal spray, then he might have a tiny bit of flu that I can then catch. So when you're having your flu jab, if you've got any children that are likely to have the flu jab as well, or the nasal spray at school, then they have to have it with you a couple of days before chemo. God, this is such a long-winded round of telling you, and I'm not even telling you, please do get advice, but that's what I've had to do today. So, oh, and my little boy actually had to have the needle one as well, as opposed to the nasal spray one, because again, apparently the nasal spray gives you a little tiny bit of the flu, whereas the injection one doesn't. So anyway, that's what I've been told to do. That's my advice, I guess, and over to you.